several states sued was had actually sued for that, and we did not technically join in that, although we wrote a letter basically saying we agreed, because once 20 states had said it, then the court was going to decide it one way or the other. There also were a lot of other lawsuits around. Did the federal government have the right to force people to buy something? There's a mandate that you buy insurance in there, and a lot of people thought that that might be where the law was overturned. I think I have my courts right. I think the Third Circuit Court basically upheld that, which surprised a lot of people. It will end up in the Supreme Court. What we have said to the Supreme Court is everybody knows. I wrote them and said everybody knows it's going to end up there. Let's just go ahead and get there and let's get this decided, because the uncertainty is killing us as a country. It's killing businesses who don't know whether to invest. As a state government, there's a huge impact on us. Here's how that works for us as a state. Remember I said our budget's about $30 billion, okay? Well, about 25% of that is TennCare, Medicaid. Of that money, the state or the federal government pays roughly 2/3 and we pay 1/3. But as the new health care law would drastically expand the number of people that we have to cover with that program. And you know, I'm a little afraid to throw numbers out, but the numbers of what it would cost us would be anywhere from $200 to $500 million a year in added cost to us. Now, what makes it even worse is the federal government gives you very little flexibility. When we set up our TennCare program, we basically, like I said, even though we put in 1/3 of the money, it's 100% their rules in terms of who gets enrolled, how the process works, can we have somebody pay, $5 every time they go to the emergency room, even if they shouldn't. A lot of things that kind of would make sense, we can't force them to do that. So my main concern is, in a very, very difficult budget situation, that money has to come out of somewhere. And if it's $300 or $400 million a year, that's $300 or $400 million that's not going to K-12. Or it's not going to higher ed, which, by the way, and there are several folks from Motlow here, that higher ed we've given smaller and smaller budgets to every year, because healthcare is taking more and more of our budget up. So my real concern is those funds have to come from somewhere. For state governments, it's going to put all of us behind the 8 ball in a really, really bad way.